So, dental health is one of the passion topics of mine when it comes to healthy aging. And the reason is that dental health overall dictates the quality of life that you'll have. Fortunately, we have incredible dentists these days who can give you full brand new teeth if that's necessary, if your teeth fall out. But the process of getting there is rather complex, and it's not an easy surgery to have these posts placed and then have full dentures done. So for that reason, I think whenever possible, it's always good to avoid dental issues. So I made a big list of things. Why? Because again, it's a passion topic of mine. So hopefully you can bear with me through it. The first one that I have on my list is to brush regularly but gently. So using a soft bristle brush and brushing softly using your two fingers as opposed to gripping it really harsh, and being gentle with the gums especially can be very effective. This is more important for people who tend to have gum recession or have a high risk of gum recession from seeing other family members. The next one is flossing. Now, I think there is some data showing that if you use a water pick, it can be good. In my opinion, it's not quite as good as flossing, so I do think flossing is better. If you have a little bit more gap between your teeth, a water pick could be just as good. By the way, when I say brushing regularly, I do mean after meals, and I definitely mean in the morning and at night. But more so, especially if you ate something that's very doughy and that stuff is really going to get stuck between the teeth, and you're going to have a day where you're going to have a lot of dry mouth, you're going to be talking a lot or not be able to drink a lot of water. That's when getting a quick brush in is really important. Other things that I think are worth I guess they're myths to dispel, is that your toothbrush can last you quite a long time, and there are many ways that you can kind of sanitize it if you need to. The wooden ones are a little bit more problematic, but bamboo tends to hold up pretty well. And you can carry your toothbrush with you. Some people are like, no, it's dirty, it's going to transmit a bunch of diseases to me. There's no truth to that. I'm a family medicine physician. Your toothbrush can be in your pocket. You're not going to transmit anything dangerous to you. I'm not saying it's sanitary. I'm not saying that it might not be gross, but having your toothbrush on you is probably better. And keeping it in some enclosed case where humidity and moisture is going to build up is just a bad idea. And flossing, probably once or twice in the middle of the day if you eat something that you think got stuck between your teeth. Maybe not as big of a deal if it's vegetables or fruit matter. Those then tend to not be as likely to cause dental caries, but other foods for sure. The next one I have is sugary foods and acidic foods. Some of us love sugary and acidic stuff, and so we like wine, coffee, and then we like sweets. If you're that person, you just got to be even more cognizant of that and just brush more regularly and rinse your mouth out after kind of a harsher meal like that, or harsher snacks. Along those same lines, I would say those of you who are snackers, who snack very regularly, you don't really get a chance to create a lot of saliva that breaks down all that matter. So you're constantly putting new stuff in that could potentially feed those bacteria. So that might be a good reason to maybe hold off on snacking. Some of those couple of hours of fasting can be very, very effective. And the next one I have here is not to brush immediately after eating something acidic. Really, after eating anything, but especially after something acidic, it softens your enamel, and that could be problematic. So just wait 45 minutes or an hour. As long as you remember to brush, that's pretty good. There's a couple of other ones that I think we'll get into. Here's something that's probably a little bit more controversial, has to do with toothpaste. So the studies that I reviewed show that the act of brushing is probably the most important thing. And there is some good data from other countries where toothpaste is actually not as often used in certain cultures and in certain regions. So it's actually the act of brushing that is much more important. Having the toothpaste is definitely great, and you can be quite creative with your toothpaste. There's many homemade toothpastes that you can use. Unfortunately, fluoride is really not that effective if you're already following good dental hygiene. If you're not following good dental hygiene, fluoride can be incredible in your toothpaste. So just keep that in mind. Much like medications for treating osteoporosis and osteopenia, fluoride does harden your enamel in some ways, but not in all the right ways that you need it to. Again, nothing against fluoride. What's necessary to understand here is that fluoride has its place, but it's not a replacement of some of those good decisions that you can make. So, early cavities. If you go to a dentist regularly and you get cleaning, they might recommend x-rays. I generally am not too worried about the amount of radiation from x-rays. I think it's minimal as far as causing cancer. Whenever you can avoid it, even the best radiologists in the world will say, hey, don't get an x-ray, that's not necessary. Getting x-rays every year for cavities is not something that is in my research substantiated, but I certainly understand that pretty much every dentist I've ever spoken to says, yes, absolutely, that's something you should do. So talk to your own dentist about that. I think there's nothing wrong with getting an annual x-ray, but when you do find a small cavity, the way dentists test for it, if they can access it, sometimes that's not the best indication of whether that cavity needs to be addressed. So monitoring that cavity, if it's an early stage cavity, could be a viable option. And if you can adjust your dental hygiene routine to help get rid of that cavity, your body can actually heal it. This is not pseudoscience. I'm not saying ignore your cavities. I hope everybody here who's listening to this is open-minded enough to understand what I'm saying and discuss it with your dentist. I have great dentists, I have a wonderful dentist, and we have these discussions all the time. And I think you can definitely do the same. Dry mouth, I kind of talked about it a little bit. Look, if you like acidic foods, sugary foods, and you have dry mouth, you're like the worst combination case. And of course, then when you have an early cavity, you really got to watch that cavity very closely. But right now I'm talking a lot. That's going to make my mouth dry. And if I'm not regularly sipping on something to keep my mouth moist, or especially if I'm somebody who's in a very dry environment, if I don't drink a lot of water, if I have a lot of tea and caffeine that dehydrate me, if I have a lot of sugar in my mouth or sweets, then all of that's going to dehydrate me and it's going to be more of a problem. So hydrating your mouth is quite important. The way to tell is if your eyes start getting dry or if your mouth starts feeling kind of dry, your lips start feeling chapped. That's how you know you're dehydrated. Just sipping water, that's all you need. And finally, the last thing I'll say, in my experience with my patients who have alcohol later at night, and who have carby stuff later at night, high carb things, even if they're healthy, they tend to have dry mouth at night when they sleep. They'll even sleep with their mouth open. So that dryness throughout the entire night can be a bit problematic. I know there's a lot of things on social media about taping your mouth, etc. Again, I haven't seen any good data on that. I'm not saying don't do it, but I would say maybe go up the chain a little bit. So upstream, the goal, a little bit less alcohol, a little bit less sugar. Hope that's helpful, guys. Take care.